So for those of you that don't know me, I'm Andrea Taylor. I'm the president and founder of A Twist of Fate for arterial tortuosity syndrome. And I started the nonprofit back in 2014 because my youngest son, Aiden, was diagnosed with ATS and back in 2010. And we had moved from Arkansas to Oklahoma, and he had had a pneumonia type illness and went to the local hospital, and it was a quite devastating and traumatic experience for him and myself. And when I realized that doctors were not listening to me and they had put his life at risk, I knew that I had to do something. And so I stepped up and started A Twist of Fate. I have been working with my partner, Dr. Armel Pendon. She's going to be co-hosting with me today. She has also a son with a rare condition. And through the years, we've been working together and looking at where the deficits were for rare disease patients as a whole. And so we created the CONECT project, and she'll get into that a little bit more. But I hope that you guys enjoy it. Just the webinars are not it. It's just one small part of our project, and we would love for you to keep involved with us. We're going to have another webinar on February 14th. So we hope that you come back and join us for that. But that is my introduction for you guys. If you have any questions, I put my email in the chat. And if you're a part of this and you have a rare condition, please be sure to let me know what your email address is and your address, because I do have something to send you. And we'll be sending those out the first part of April. All right, Armel, welcome, and please introduce yourself.
Hello. So as Andrea already did the job, I have a PhD in neuroscience. So I'm not a specialist of connective tissue, but I'm a specialist in pharmaceutical drug discovery. So that's my adding part to the CONECT platform is really to everything in the direction of finding a treatment for rare disease and establish everything for a good roadmap for drug discovery. So welcome to the second panel. The goal of this series of 3 panels is really to give you the opportunity to talk. It's not a webinar where an expert is going to explain you something. You are the voice, and the experts are going to listen to you. And we want to have your point of view and your experience, and today sharing your experience with the rest of the community. It's usually the patient engagement is really in one direction, but today we really want to have the patient voice. And the theme today is current and future treatments burden. So maybe to give you a bit of feedback for those who were not there last week. So the CONECT is to build a cross-cutting rare disease partnership among connective tissue rare disorders. We want to address the common limitation and challenges. So that's the big part, is that today you can notice that the patients have different backgrounds and come from different disease, but all of you have a connective tissue. And taken one separately, you are a very small community, but all together, maybe we can do something more efficiently. So we want to align the medical care with the medical needs according to you, the patients. We want to empower you with the appropriate knowledge to have an efficient dialogue with the clinicians, your physicians, so that you can explain properly your manifestations and your challenges. We want to identify and disseminate specific and differential training for medical staff that are confronting with connective tissue disorders, because that's not a big part of their training. And I think it's more our responsibility to pinpoint in this project where there are gaps in the knowledge and the training they have, where the gap is, and address those issues with master classes. We want to inform PCOR priorities and PCOR SARE. So SARE, it's research in general. Research, but really focus on the patient. So we want to have patients that are better equipped to dialogue, as I said previously, so that we can maybe listening to a better description of the manifestation will lead to new research topic. The differential training can identify the gaps in the outcome measurements. So if we talk with the clinicians and the dialogue with the clinicians might reveal some gaps also in the techniques, the technology to measure outcomes from the patients. I don't know, imagery or whatever, like 3D imagery. Is it okay? Do we need to do more? So that can lead also to new research subject. Our really close objective is to use the virtual convening, listening to patient voice to explore the patient's needs, answer the challenges and make proper medical decision, use expert clinician analysis to create the content of master classes, and create a partnership and disseminating platform, including interactive webinar and a hotline to share the observation and information. So those panels today and last week and in 2 weeks, they are not really the webinar where we are going to address the gaps. Those panels are to identify the gaps. So how does the CONECT platform work? Well, we have the patients on the panels. We have the clinician also analysis that goes through a kind of lens. What do we want? We want to improve care, and we want to educate and identify new research in a manner with a cross-cutting analysis. So what is in common in between all the connective tissue patients that are present? And then that will lead to education webinar of the patients and of the clinicians. So the impact we want to have is we would like that the interactivity of the model will allow adjusting the focus of cross-sectional issues in similar rare communities to address patient needs and evaluate the priorities and the new research. The platform will have a direct impact on awareness of the clinical community. So really we want the clinicians to know more about connective tissue disorder, and an indirect impact through increased ability of the patient to advocate. Oops, sorry. So at the end, the long-term objective is to implement new research study. And the final goal is that the new research will lead to more information on the rare disease, leading to a stronger rare community that can make more informed decision on their healthcare and increase the quality of life. And all this is a kind of circle and will feed each other. So that's the way we planned it. And for today, we are going to ask you some reflection around 4 different questions. What type of medication do you take and how beneficial they are? What type of equipment do you use and how are they adapted to your needs? And in the second time, we'll go around again. So the first part, I would like you to address these first 2 questions. And then after that, we'll go around more what symptoms would you prioritize for new research treatments? And what effort would you make? So what are you ready to do to participate in a clinical trial? And what are you not ready to do? So Andrea, you know the different panel participations. I give you the floor, so you can start.
All right. I'm not sure if you guys would like to introduce yourself and your panelists this week.
Yeah, sure. Hi, everyone. My name is Kate Weirs, and I'm the Executive Director of the Myri Syndrome Foundation, and we represent a rare connective tissue disorder. That's why we're here. And I was on the panel last week speaking about my personal experiences with my son who has Myri. But this week, I'd like to introduce you to Patty Schultz. Patty is on our board, as well as somebody who has Myri, and Patty can introduce herself in more eloquent ways than I can, so I'll just hand over to her straight away. I'd also just like to introduce Don Clark as well, who you'll see on the call. Don is our Vice President for the Myri Syndrome Foundation as well. Thank you.
Welcome, everybody. We're happy to have you guys.
Hi, I'm Patty, and I am a 52-year-old woman who was diagnosed with Myri syndrome 2 years ago. It was a 50-year-long journey to find a diagnosis. Many setbacks along the way, and I finally got involved in Mayo's diagnostic journey program, where they got enough evidence together um, to run a whole genome sequencing, or whole exome actually sequencing, and it came back with Myri syndrome. So I finally had an answer. For the last 2 years, I've been on the board, and I've been learning a lot about this illness and participating in every research opportunity that has come up, and making sure that if I have a surgery, that they take a tissue sample so that they know what the tissue looked like, if it was abnormal, if it wasn't, if what was going on, and just making sure that I can educate in every way possible. And Myri syndrome is primarily a connective tissue disorder. It affects every system in the body. So there is not a system that I have that is not affected by it. And I kind of giggled when it said, "What type of medication do you take and what are they?" I would probably take most of the panel to list most of the medication that I am on. There are a lot of them because it just affects everything. And I'm not sure what else you need to know. Is there anything else that I need to address at this point in time? You're on mute.
Thank you very much. For the medications that you do take, how beneficial are they for your symptoms? Do you feel like they help with the symptoms, or?
It depends on the symptom. The blood pressure medications that I'm on work very well, and have for many years. The diabetes medications do not. My diabetes is weird. It does not respond the way that most normal diabetic patients respond. So I get blamed a lot. You're not eating the right things, you're not exercising. And it's like, but I didn't do anything different today that I did yesterday. And today my blood sugars are in the 300s, and yesterday they were in the 80s. And I did nothing different. The medications for pain are absolutely ineffective. They're not working well at all. And they can't pinpoint exactly what it is that is causing the joint pain that I have. I have had 25 orthopedic surgeries, and it is looking like I may have to have a fifth spinal surgery. And so the medications are just not helping with those types of symptoms at all. And I have access to Mayo, so they have run. I mean, they can run tests that nobody else has heard of.
Yeah.
They did a genetic analysis of how medications affect me personally. And so I was able to see that some medications I rapidly metabolize, some medications I don't metabolize at all. And some medications are kind of a medium thing. And so that was really cool. We were able to adjust the dose on like the reflux medication that I'm on, able to adjust that dose to meet my specific needs because I rapidly metabolize that. Um, so they're just not, it depends on the medication and what it's for, whether it's effective or not.
Patty, thank you so much for sharing that, especially about um, the test that you had to see how you metabolize medications. That is
Mm-hmm.
actually called pharmacogenomics.
Mm-hmm.
And it is becoming more and more popular, and many labs are offering that as part of their testing options. I work in the industry, so I know a lot about pharmacogenomics, and it's very interesting. And I'm glad that you've had it. And I wish that you were getting a better answer about how your diabetes medication was taking care of your particular issues. I don't know if you mind me asking a pointed question, but with your diabetic medications, are you doing some like the shots like Trulicity or one of the others like that? We're not being.
So I am on an insulin pump,
Mhm.
even though I'm type 2. I'm on an insulin pump and have been for about 8 years now. And I kind of feel that with being type 2 and having insulin resistance, that it's kind of like trying to treat a fire with gasoline.
Yeah.
We're pumping more and more and more insulin in, and it's not really doing much of anything. And then I'm on Jardiance as well, which does help. I tried Ozempic, um, and it took away my appetite completely. I
Yeah.
mean, then I didn't want to eat at all. Uh, and then Trulicity, I want to try that one again. I had tried that immediately after spinal surgery, and I think it was too soon. Um, so I'm trying to get in to see my endocrinologist to do that. I have been on Victoza, and that worked for quite a while, and then it just stopped working for whatever reason. It just didn't work anymore. Um, and I think I've been on almost every single medication out there that is for diabetes. Metformin has severe side effects for me. I have tried that medication, I think, like 8 times now. And every time I go into the doctor, they're like, well, have you ever tried metformin? Can you look at my record, please? Yes, I've tried it. The last time I tried it for 8 months, and no, I cannot take it. So, yeah, it's been a rocky road with that.
Well, I really appreciate you sharing your story and letting me ask that pointed question. I think what we're going to learn at the end of all of this, when we start really looking at the mechanisms behind each of our connective tissue disorders, like I know that we have similar overlaps in symptoms, but there's always room for more research when it, comes down to the bottom line. So that's what we hope to take from this, is not only to be able to help with the providers to understand our conditions, but to also work with the patient group leaders to where we might be able to partner on some of these issues that our families are having. So I really appreciate it very much, Patty. And I know that we'll be back around to you here in just a second. Next on my list, I'd like to ask Gavin Day if he would like to introduce himself. And Gavin, your mom can help you if you feel like you need any help on this.
My name's Gavin Day. I'm 15 years old, and I live in the Cherokee Nation Reservation, and I have FG1 syndrome. And yeah.
Fantastic. You did great. So Gavin, can you tell us a little bit about the medications that you take on a daily basis?
I take headache medicine. I take inhalers. Yeah, I can't help with this. I don't really know the names of them.
All right, Jade, you might have to mute yours for a sec. Just we got a little bit of an echo.
Can you hear me?
Yeah, we can hear you.
He takes migraine medicine. He takes Topamax, atenolol, and albuterol, and asthma medicines, and allergy medicines. As Gavin says, too much medicine.
Thank you so much, Jade.
Jade, can I ask you which type of migraine medicine does he take?
He takes, let me get it real fast.
Gavin, while your mom is getting that for Armel, do you how do you feel like the medicines help with your symptoms?
It's not really working. I'd say it's trying to help, but not really.
Like the asthma medications, do you feel like they help?
Yeah, I see those helping. The headache medicines, I don't know about those.
Yeah. Are you still having them as often as you were before?
Yeah.
Yeah.
And Gabe, do you take any anxiety medication, anti-anxiety?
Atarax.
My mom said, I think. The headache medicine is called Atarax.
No, it's not the headache medicine.
Wait. I don't know. My bad.
He takes Atarax if he does have anxiety because he has a negative reaction to SSRIs.
Yeah, and I was asking for the migraine because the migraine.
I sent it through the chat, Armel.
Oh, let's see.
Paxlovid or whatever it's called.
Can you see it in the chat, Armel?
Yeah.
Okay, good. So Gavin, do you also take seizure medication?
Yes.
Topamax.
Do you feel like it's helping?
Yeah.
Yeah. So is there anything that you'd like to tell us about FG or anything? Because you weren't on our panel last week, and we'd love to hear how you feel about FG.
I usually get angry sometimes over the littlest things. I think that's part of the syndrome.
Well, because he likes to want to keep up with his peers. But like he wants to play football and that he can't play football and stuff like that. It really bothers him, upsets him a lot. That's the stage we're in.
Yeah.
I know this is probably scary, excuse me, to talk in front of this group of people, but you can all consider us family here because we're all in the same boat and we all have some similar symptoms and issues that we're going through. So please don't feel nervous. You're very welcome here to speak out any that you would like. Would you feel more comfortable if I went to the next speaker for a few minutes?
I'm fine. Yeah.
Okay, good.
Yeah, I think that's all. Yeah.
Okay.
Oh, yeah.
All right. Our next guest is Dave. Dave's story on our last call was quite impressive, and I'm very glad to have you back again this week.
Thanks, Andrea. I'm not sure where to start, so why don't you ask me a question and so I don't get crazy again.
Would you mind giving us a quick rundown of your story and then talk to us about medications and how you feel that they're working for you?
Yeah, so I didn't see I'm not listed. I have a connective tissue disorder that is an ultra rare. It's called cutis laxa, CUTIS. In fact, I can type it in here. It's one that you can actually say, right?
Yeah.
Compared to some of them. So I was evaluated for Marfan's and Ehlers-Danlos and a whole lot of other things. And my story is I got pneumonia and it saved my life, if you can believe that. So I had my sister and I both had open heart surgery as kids. We were born with congenital heart problems. They were both repaired when we were 5. She's 5 years younger than I am. And then I knew that there was some problem, but it's long before genetics. So you just live and basically I lived my life. And then when I was 60, I got pneumonia. And in the course of treating the pneumonia, they did a chest x-ray and discovered that I had a large aortic aneurysm ascending, so 4.2 centimeters. And so I called my sister and said, get an echocardiogram. And she had the same aneurysm, much smaller. So as I often say, the good news for me is that by then I had raised a daughter and she was a professor at Emory in genetics. And so I became her patient. We tried to figure out what I had. And they sent me to a lot of places. I went to University of Pittsburgh, Johns Hopkins, Emory, where she was, did a full genome study of my whole family and figured out it was connective tissue. But at that point, cutis laxa was not well known, so we didn't know what it was. It was off one of the mutations. So it took another 3 years, and we finally figured out that it was cutis laxa through additional information. In the meantime, my aneurysm was continuing to grow. So my treatment for the aneurysm was losartan, and that was recommended by Johns Hopkins, Dr. Hal Dietz. He said, we don't know why this works, but some people, it slows the growth of their aneurysm. So I said, well, let's try it. And it basically is a blood pressure medication. And my problem was I have low blood pressure. So when I first started taking it, it kept putting me to sleep. And it did slow the growth of the aneurysm, but also couldn't stay awake. So we had to play with that for a while and adjust it. But it really helped my sister. It stopped the growth of her aneurysm. So it was much smaller at that time. So anyway, my aneurysm progressed to 5 centimeters. In fact, it's been a year. Last February 11th, I had 2.5 inches of my aorta replaced. So it basically the aneurysm was getting close to dissecting, which is not a good thing. So they replaced it, and I've been in recovery since then. So the only medication I had up to that point was losartan, and now as a result of the open heart surgery, I developed arrhythmia, of course, something special to have. So I take metoprolol, metoprolol. There, I'll get it. For the arrhythmia, I also wear an Apple Watch, which does ongoing EKGs, and I've had no incidents in the last 6 months. So I had some early on, and then it stopped. And I also take a statin for cholesterol, which is I'm not sure, we don't know if it's related or not, but those are the only medications that I'm on. My sister is just on a low dose of losartan, and the likelihood is she will never have to have the second surgery. So it's not really a treatment, but it quarter is a treatment, right? It's a big thing if she can avoid open heart surgery for the second time. So that's my story. I was when I got diagnosed, there was a small support group. There were only about 10 of us that were identified initially. Now we're up to 400. And we have been in a study at the University of Pittsburgh trying to figure out, where to go from there. But we still weren't big enough that we've gotten any pharmas interested in working on a treatment yet. And the support group for cutis laxa, which is how I found out about you, is in France. And they are a very active group, and they're doing a lot of things and having a lot of conferences to try and figure out what treatment can have. And cutis laxa runs the gamut of, as you can see in my case, I've made it to 75, and I'm reasonably healthy. I have problems with lightheadedness and fainting, but as far as physical things, cutis laxa usually affects the joints and the bones, and many of the people in our group have very serious problems, especially a lot of kids have a lot of trouble doing anything. So I'm fortunate that half of my genomes are not cutis laxa. So my mother's side of the family is Italian, and that gave me some strength to survive a lot of things. So that's kind of the way I've made it this far. But I would say, yeah, I feel I don't have the stamina that I used to have. I don't fly airplanes anymore. I was a professional athlete. I don't do that anymore. But I can still walk. So I can walk 2 miles a day, and that's what I do. And that's kind of my story. I would mention, much as you did, Andrea, that way back in the beginning, as I got into this with my daughter, we decided that there wasn't enough information. So we actually started 2 companies, one that you'd be interested in called the Think Genetic Foundation, thinkgenetic.org. Mm-hmm. And we just gave 7 grants last month to, we're sponsored by the pharmaceutical industry, and we give education grants to help people right now medical professionals get education on various rare diseases. So it's not limited to cutis laxa, any rare disease. And then we also have a database of about 300 of the rare diseases in my other company called Think Genetic, and it's a for-profit company, but thinkgenetic.com, and that's free to anybody that wants to use it to learn about the various diseases. And actually, we look for feedback from the advocacy groups to make it better. It's all done by medical professionals, so it's not just hearsay. And the biggest section that people are interested in is the part called living with the condition, which I'm sure is what we're all interested in, all the various things we have and do. So feel free, if you like, to look at either of those things.
Thank you so much for sharing that.
I hope it's helpful. Yeah, I'm
very much so. Very much so. I can see everybody's taking notes, and I'm glad that we're recording this so that I can go back and listen to it again. I don't know if you know this, but arterial tortuosity syndrome is actually a subcategory in ways of cutis laxa. Like, we're very connected to each other. Yes, sir. So Zolt Urban and Bert Callowert are friends of mine, and we work very close together. And there's a lot of stuff going on behind the scenes. So Dave, I definitely want to talk more offline about a lot of this. There's a lot of things that we could work on together, maybe to help solve some of this. So thank you so much for sharing. Do you feel that the medications are helping take care of the symptoms that you're having for the most part?
Yeah, I think other than the lightheadedness. So I've actually, one other small story is I do a lot of choral singing, and I was doing a solo last month and I passed out on the stage as I went up to sing. So that made a big hit on everybody. And I don't know why. And I did come back 3 weeks later and do it. So it's not stage fright. It's just something happened.
But it didn't happen the second time, right?
It didn't. It hasn't happened any other time. That's the only time I've ever, I'm always careful about being lightheaded, to stand and get my balance before I do anything. And once I'm up and going, I'm fine. But it's like my body shuts down and I have to wake it back up anytime I get up. So like when this meeting is over, when I stand up, I'll have to hold onto my desk for probably about 10 seconds, and then all of that'll pass. And then as my wife says, she'll wind me up and off I'll go. And that's the way it works. But that's the only, yeah, the arrhythmia, I haven't had any issues with that, which is wonderful. I mean, that's no fun when your heart just decides to take off. So that's the only side effect. And I just had my latest CAT scan, and everything was normal, if that's a correct word for any of us. But yeah, everything was the way it should have been after a year after surgery.
That's fantastic. I'm glad to hear that.
If I can add, the singing modifies the diameter of the vascular system of the veins. So if you sing really really loudly, you modify your blood pressure and everything.
Yeah, I think it's related to, because we rehearsed for half an hour and I was on my feet, and I've just never had the problem of passing out. When I get lightheaded, I just sit down. In this case, I really sat down.
You didn't hurt yourself though, right?
I didn't hit it. They said you didn't hurt the piano. You just collapsed in a heap, and you were very gracious. Clearly your athletic training helped you fall gracefully. So I just went down in a heap. They said, I don't know.
Patty, you have a question?
I'm not sure if we're allowed to crosstalk here, but I didn't get to some of the things that I'm taking as well. I just wanted to say I'm also taking metoprolol for an arrhythmia. And that was what started the journey for me to diagnosis. I had carpal tunnel surgery and I had an EKG done because I was having surgery, and it came back that it was abnormal. And I went in for a stress test, and I was having non-sustained ventricular tachycardia, actually. The doctor sent me home, which to this day it just amazes me, because I worked as an ER coder, and I was like, oh my God, VTAC, if that becomes sustained, I'm dead. Why are you sending me home? But they put me on metoprolol at that time, and it has been controlling that arrhythmia since then. My aorta is also abnormal, but it's constricted. It's not I don't have an aneurysm. Instead, it is diffusely narrow all the way through it. And so my primary care physician, by putting me on lisinopril HCTZ in my 20s, when my blood pressure started to go up a little bit, he said because I was diabetic, he was going to treat me like I'd already had a heart attack. And he actually kind of saved my life by doing that. And so um, that's a couple of things that I forgot to mention. And then the asthma medication, too. I have restrictive lung disease. And for years, they kept telling me I had to take albuterol. And all it did was make my heart beat fast because my lungs are fine. It's the rib cage that is not expanding, it is constricted. And so by taking the albuterol, it was doing nothing because I just needed more room to breathe, not my bronchial tubes to be opened. They were fine. And so, I can relate to a lot of things that are being said here. It's interesting.
Thank you so much, Patty. I'm glad that you shared that as well. And yes, we can crosstalk. We do try and have some structure, but there's no real rules. We just care about what you guys have to say, and thank you for that. Our next speaker is not last but not least is our panelist is Christian Burns. Christian, are you still available?
Yes.
Are you comfortable doing your video, or are you having issues with it still? I love seeing your face, Christian. So would you like to introduce yourself?
My name is Christian Burns. I'm 23 years old. I was diagnosed with ATS when I was 17 years old.
Christian, what kind of medications are you on?
Heart medication, blood pressure.
Do you feel like they're helping so far?
They are.
And I don't want to put you on the spot, Christian, but do you want to tell them, I know that you've had a pretty significant surgery for someone with ATS. Would you be comfortable telling about that?
Yes. I had a heart transplant when I was 9 years old. It was March 30th, 2009. I'm actually coming up on the 14-year anniversary of that next month.
That's amazing. How about some of the other things that we've been involved with Dr. Warner and his group?
You talking about the conference?
No, your glasses and what's going on with your vision.
Oh, they said that my left eye, I'm never gonna be able to see out of it again, but my right eye is doing good. They're actually, I gotta make an appointment. I gotta go back. I've been having a lot of pain out of my left eye. They're gonna give me a shot that deadens my left eye to where I can't feel it, so it won't hurt me anymore.
How do you handle the vision changes that you've had?
It really don't affect me. I mean, I play video games. I ride my four-wheeler down the road.
How about cooking and stuff like that? Are you still able to do most of those activities?
I cook every now and again. I don't cook like I used to because it's just like my eye gets to where it's watering a lot, so I don't really cook like I used to.
Yeah. Well, we really appreciate you being on here and telling your story. And is there anything else that you would like to tell about your experience with ATS? Is there things that have made your life better or things that have made it harder?
I think it was just like a blessing that I came into this group because in 2016 I had a heart like I had a heart surgery like to help. You know what kind of surgery I'm talking about? I can't remember the name of it.
Heart cath.
Yeah, I had a heart cath in 2016. I went in, it was September the 8th. I thought I was going to wake up later that night. I wake up, it's October the 5th. They tell me that there was problems with my heart cath. They don't know what happened, but whenever they had me intubated, the breathing tube that was down my throat, I coughed it up, and when that happened, my left lung collapsed, and I was in the hospital. They said that they'll never explain it. They said it's a miracle that I'm even alive. They said thank God I'm alive, but I had to learn how to walk again. I did not get to go home until November the 11th, so I was in the hospital for 2 solid months. And sometime, I guess, February of 2017, my mom was looking at groups because the doctor said when I was in the hospital, I finally figured out what my syndrome was because we've been trying to figure out ever since I was 7 years old what syndrome I had. They said, you have arterial tortuosity syndrome. So my mom was poking around on Facebook in February of 2017 and found the group, and Andrea texted her after Mama joined the group, and everything just went on from there. We went to our first conference in 2017. I'm glad that I'm a part of that now.
You're going to make me cry, Christian. Thank you very much for sharing your story. And you know how we all feel about you, and we're super blessed that everything has worked out the way it is, and that thank you so much for sharing. We really, really appreciate it.
I'll also take pride in the thing that you were saying, that now that y'all know that I had a heart transplant before I was diagnosed with ATS, that gives your children the chance of having heart transplants if they ever need it. Because I think y'all said that children with ATS can't have heart transplants.
Well, and to give precedent to everybody else that's here, arterial tortuosity syndrome is known for causing the mid to large size arteries grow too long, kink, and twist. And so it is like a spider web of crazy, just a bunch of crazy nest of arteries and things like that in the ATS patient's body. And so typically, if a child were to have a heart transplant with ATS, the tortuosity would affect the next heart. So it's like you would be constantly needing to have transplants, but not every person with ATS has the severe tortuosity that, for example, my son Aiden does. So we were told when he was very young that we had to do the heart cath because he would not qualify for a heart transplant, and he was starting to go into right heart failure. So it is amazing that Christian has been blessed to be able to have a transplant, because it will give us, he has proven 14 years out that in early indication or thought that an ATS patient would not qualify. We do have a fighting chance to do that. Our unfortunate, our patients need to have that. We have something to fight with. So Christian, we're very grateful for you sharing your story.
Christian, if I may ask, do you take any pain medication, and how are they efficient?
I take pain medication, but not like whenever I'm hurting, I go to the doctor and they'll give me some, but I don't hurt like I used to.
And when you say hurt, is it your eye that's hurting, your full body pain, joints?
It's mostly my eye.
And just to let everybody know, ATS is known to cause issues with the cornea, and patients can also have retinal detachment. And I believe that is, Christian, that is where your issue started, was with the retina detaching, isn't it?
Yeah, the first eye surgery I had in 2018 was my retina detached, and they tried to fix it. And then I went back for them to look at it, and they said that a cataract was in the way, so they couldn't tell. So they went in for a second surgery, take out the cataract. And when they took the cataract out, they said my retina detached again.
Armel, do you have any questions for Christian or anybody else on the panel or joining us?
No, I think I'm taking notes like crazy and trying to understand what's the main commonality between all the patients. But no, for now, just go on. We still have 3 questions to go, and I don't want to interfere too much. And I would like to have also more patient sharing about the equipment they are using and the help it gives in their daily life.
And we don't have to go in order. First person that wants to talk about that, please go ahead.
Say about your heart too.
I've also had heart caths, Christian. So, yeah. Vision problems and all that.
I think you guys should be on a group chat after this.
Yeah.
Tell about your equipment.
Yeah, I also have a cane. I have braces for my braces. I was called braces. Evos, and what's that thing called again?
A CPAP.
CPAP, yeah. CPAP.
I have a BiPAP.
Yeah.
Do you guys wear it every night?
I do.
Yeah.
Good. I have a BiPAP as well. So I wear mine every night as well. And you guys' sleep got better after using it?
It did.
Yeah.
Do you have more energy now?
Yeah.
I have a
Christian?
CPAP as well.
Oh, hi, Maya.
Hi, I didn't know if I sent you a message when I came on. Sorry, I was late. I don't wear mine because it's really difficult. Like I haven't been able to get a full night's sleep with it. And one of the pulmonologists explained that because our faces with Marfan syndrome are shaped differently, it's really difficult to find a mask that will fit appropriately. And so, you know, when I got a new CPAP, the company said you can have mask 1 or mask 2. And there were 2 options. And neither one of them worked. And so the doctor's solution was to go online and try to find one on my own. But that gets really expensive.
It does get really expensive.
Be buying masks that insurance is not going to cover because it's not from the company that's providing the CPAP. And so that's been a barrier for me to being able to use the CPAP. Luckily, my sleep apnea is mild for right now. So it may be something I need to revisit again in the future. But that's adaptive equipment that would probably be helpful that just is not easily accessible.
No, that's a great point.
Yeah, and I don't know how many of the other conditions, I would assume Louise Dietz probably has similar issues to Marfan with the makeup of the face. Julian used oxygen for quite a while when he was a baby for sleep apnea and then unknown issues because he would destat. So we had a portable oxygen tank and then a big oxygen tank for his room. And I use a walker and sometimes a cane. The walker is less because of like instability on my part and more so I don't have to carry things. So I use it to like carry my backpack and my lunchbox, and then also to provide me somewhere to sit when I'm in like a patient room, or I went to the zoo with my classmates, and so then I could sit on the walker while we were looking at the different exhibits. And the cane I use if I'm going to be walking for a long time.
Is it all of your joints instability, or like your hips or your knees worse?
It's mostly for back issues because I have dural ectasia. So the dura sac that protects the spine is full of cysts, and it causes a lot of lower back pain and then some leg issues too. And we try to do anything we can to avoid inflaming that area. So if I am carrying my backpack, that throws off my hip alignment, and then that can cause issues. So more than the backpack being too heavy for me to carry, which is definitely a consideration, especially given the dissections that are healing. we don't want to throw off alignment with the back of the hips, because then that might set off a flare with the pain, with the dural ectasia. And that's why I can't stand for very long, because of that back pain.
Any other, do you or your son use AFOs?
Julian did for a long time. I have like inserts that go in my sneakers, just that like I bought on Amazon. But Julian has a lot of ankle issues. And so until he was 10, he wore some sort of AFO. Sometimes when he was younger, it was just the kind that went in his shoe, but it progressed to the ones that go like mid calf, and we got them hinged because I learned from another adult at the Marfan conference that helped preserve some of the ankle movement.
Oh.
And that was a concern for connective tissue patients using AFOs, that it would further deteriorate the muscle strength that we try to build up. And so the solution to that was to put in this hinge. And we kind of had to get the physio doctor that we were working with, a sports medicine doctor, to buy into that, because usually they just use it for people with Achilles tendons issues. But he was willing to give it a try for Julian, and then saw how his ankle strength improved while using the AFOs, which is not what you would expect to see. And we think it was the hinge in conjunction with continuing physical therapy. So by the time he was almost 11, he was able to stop using the AFOs, and he just used gel heel pads to help, because he was diagnosed with Sever's disease, which is an issue with the heel. But he's able to get around okay without falling all the time. He still uses his wheelchair for distances, and he has a smart drive, which is a battery that takes a manual wheelchair and turns it into an electric wheelchair. And it's operated by like a little, looks like a Fitbit on the wrist. So he can tap the chair twice and it turns it on, and then he can kind of steer just with the wheels. And then 2 taps and it turns it back off.
Does he try to do a lot of wheelies with it?
No, it's too heavy for him to be able to
That's
do
probably a
the
good thing.
wheelies. With the smart drive battery is like 10 or 15 pounds, and it hooks to the back of the chair. So he can do wheelies if he doesn't have the smart drive on, but if he does, that prevents it. But he can't get himself around in the wheelchair without the smart drive for very long, because of the deterioration of the shoulder muscles. We don't
So
want to
I'm
risk that
gonna,
damage.
so I take it for those with Marfan syndrome, it's very hard to build muscle, right?
Right. And our muscle does not recuperate from injury like typical people's muscles do. And so there was some research on that his physical therapist found to justify to the insurance company why we needed the smart drive. Because any full-time wheelchair user is going to have shoulder injury from pushing themselves. And he's going to blow out his shoulders. We don't want that to happen. So having this extra equipment will kind of preserve that movement for him.
Did that change the type of vehicle and things that you as a family decided to drive due to the adaptive equipment that you use?
We use a minivan because I've got 4 kids. So, but it's why I did not want an electric wheelchair, because I would not be able to pick up a scooter. Well, a scooter wouldn't provide him with the upper body support that he needed when he was younger. And we couldn't afford a van that would have like the ramp and things come down, because insurance doesn't cover that. And we wouldn't be able to fit everybody else in the van. So we needed a lightweight manual wheelchair. And then the smart drive would allow him to get around with it. So his wheelchair is 20 pounds and it comes apart. The wheels pop off, the thing folds into like a small suitcase size. So it fits really easily in our trunk, and I'm able to get it in and out of the car myself, which I would not be able to do with something more heavy. So that was definitely a priority in figuring out the right chair for him, would be that I could help him with it.
Thank you.
I have
That's
a
just,
question, Andrea.
yep, go ahead.
Do any of you use wearables to follow the evolution of the disease, and like they use in myopathy or Duchenne, or and have some kind of monthly evaluation through those wearables or through virtual measurements on specific task? Can you get up from a couch? Can your son get up from the floor? So how many of you uses those kind of equipments or softwares?
I have the Apple Watch I mentioned, Armel, before, that if I have an episode, an arrhythmia, that will be sent to my cardiologist. So it does measure ongoing if that happens. So I was surprised at what the Apple Watch can do. So
That's a great grant for us to write to get our population's Apple Watches.
that's right.
I use a Fitbit too. It's really useful.
Does it measures your heart rate as well, doesn't it, Gavin?
Yeah, and blood oxygen and all that.
That's the one I learned.
Yeah.
Yeah.
Yeah,
I
like-
just learned that it also measures your ovulation cycle, but I haven't had much luck with that.
If you do, we need to know about it because there's another area of research we need to jump into.
So none of you use the same software or ability as the patients in myopathy and muscle weakness disease do?
What type of devices do they use?
Well, they participate in studies to evaluate their mobility and the evolution of their mobility in very specific ways, so that we can identify different type of muscle weakness and where we should go, in which direction we should go for research.
No, Marfan patients don't get sent to neuro for the muscle issues. The only thing that we would see neuro for is surgery for like the dural ectasia. But as far as like the low tone and things, it's progressive, but not in the same way that the muscular dystrophies are. And so we don't see those specialists that they do.
Okay. And do you use any physiotherapy, aquatherapy?
I know patients who do. We don't have access to it where I live, but I would. We've had multiple doctors suggest it for my son, but he doesn't want to take swim lessons, and there's not an aquatherapy place here.
And Gavin, do you do any physiotherapy or to?
I do PT.
You do PT.
Yeah.
Okay.
And tell mute it. I'll do it.
All right.
Excuse me. He did the gait trainer thing where they put him in that electrodes to see his gait with the Shriners.
Mm-hmm.
I think it's called gait mapping.
Yeah. So do you have the feeling that the physiotherapy is helping, Kevin?
Yeah. Yeah, because there's weren't they the one that assigned the braces?
Yeah, and they got you walking.
Yeah, they got me walking and all that.
Okay. And is
So Myhre syndrome has not been studied enough. I'm actually the oldest person alive with the disease. And I'm the only one with a variation in the world that I have. And so it hasn't been studied enough in adults to know what the effects of it are. I know that my muscles are weaker and are weakening. I cannot get up off the couch. I can't get off the floor. I have to use a walker for longer distances because last summer I almost collapsed because my legs just got so weak that I couldn't keep going forward. But every test that they do does not show why that's happening. And my muscles are actually getting bigger, not smaller. So I look like I've been working out a lot, but I think that fibrosis is actually taking over the muscle space, or they think maybe compartment syndrome is happening because the muscles are getting so big that oxygen can't get to them. Um, so I use a walker for longer distances. It's a wheeled walker with a seat. They don't want me to use a wheelchair because they feel that if I use a wheelchair, it will take away um, some of the mobility that I have, and they're worried that I will decondition. And as far as the CPAP goes, I have exactly the same issue. My face is not structured normally, and so I cannot get a CPAP mask that fits me properly and that will seal. I have tried the nasal ones, I've tried the full face, I've tried the partial face, I've tried just about every kind that there is, and none of them work. But my oxygenation is sitting at between 80 and 85 at night. And so, but it's regular. So the lung doctor is not sure that it's apnea. He thinks it might be the restrictive lung disease. I'm about to go in and see the sleep doctor, and most likely will be put on oxygen at night to help with the oxygenation rates. I also use AFOs to help with not AFOs. Sorry. No, I use like assistive devices to help with getting dressed because I don't have the flexibility like to put my bra on. I use a bed rail to move at night and to get out of bed, and I have a like a ladder to help me get up off the couch. To pull myself up. And things are getting progressively worse. The other thing that someone said was that if they get injured, they don't recover as normal. So, say I'm getting ready for a party and I, do a big cleaning of the house, and you get sore for a couple days after that. I don't recover from that. I progressively get more and more and more sore until the pain cycle is broken somehow, usually with like a few days of opiates or something like that, just to get the muscles to relax. And so I'm trying to think of anything else that I use. We just bought a bigger vehicle because my walker was barely fitting in the car that we had. So we got a vehicle with the um with it in mind that I may need a wheelchair someday. And I think, I use closed captioning all the time for everything. I have 95% of my hearing is gone. I have bilateral hearing aids. They're amazing. Otherwise, I wouldn't be able to hear you guys at all. I'm at the level where I should have cochlear implants, but my speech recognition is still too high, so they don't want to do that. They're unsure of what caused the hearing loss because most people have conductive hearing loss with the condition that I have, but mine is sensory neural. And so it's different than the other people. They're unsure of what happened there. I do know that my temporal bones are extremely thin, like they're almost in between the inner ear and the brain, they're almost gone. That was another abnormality that they saw on CT scan. And so I think that's all the AFOs that I use right now.
So your glasses, if you will notice that the majority of us with connective tissue conditions, I'm a carrier, so we do know that there's a little bit of a phenotype for carriers that have ATS. Tell me about your vision. How is that, are glasses helping? Is it progressing fast, or what makes you need to have glasses?
My vision is weird. I have one eye that is farsighted and one eye that's nearsighted. Every time I go into a new place to get glasses, they're like, "This prescription is wrong," and I say, "Nope, it's correct. This is exactly what I'm supposed to have." I have a severe astigmatism in the
Yeah.
consistently. Um, but I don't have any of the things that they've seen with Myhre syndrome. I don't have the papilloedema. I think I'm saying that correctly. I don't have any retinopathy with diabetes. I don't have any of those issues yet. I have cataracts, though. I'm still fairly young for those. 52. So they showed up like 4 years ago, but they're very slowly growing.
Yeah.
Um, and my prescriptions, I can actually see better without my glasses on, but I can't see distance without my glasses. So if I'm doing close-up work, I prefer to actually not have my glasses in and I can see better. But if I'm driving, I have to have them. So I usually wear contacts, daily disposables, because I can't any other contact that I wear, they're uncomfortable within, a day or two. So I do the daily disposable ones, and then I wear readers for reading when I have those in.
Okay. Thank you. Thank you for sharing that. Gavin, I got a message that you might like to talk about what's going on with your vision. Can you tell us about your glasses and what, just a little bit about the issues that you're having?
I have no peripheral vision, so the glasses can't really help with that. Is it astigmatism?
Stigmatism.
Astigmatism. Yeah, I have that, and my left hand, my left side's carrying. My right side is the
weaker side.
Yeah.
Well, do you feel like your glasses are helping with the parts that it can help with?
Yes. Yeah.
How often do you have to rely on your cane?
When I go on corners, when I go if there's a huge corner I have to go that way, I have to cut this way because I have no peripheral vision right here.
Yeah. So I don't know if your mom told you, or I'm sure that you guys have ran through the gamut with your mom because she's a mama bear for sure. But for everybody in the group, I just want to let you know that a twist of fate last year before, we worked with a vision therapy service called New View, Oklahoma, and we did a series of videos that give you just some really quick helpful hints for a broad area of vision issues that our connective tissue population might encounter, and a little bit of idea of what might be able to help you do some daily tasks easier. Sometimes it's changing the font on your phone. Sometimes it's changing the color of the background, or maybe or even changing the brightness on it. But if you guys are interested, we'll get you the links of the video, show you where they're at, so that way you can watch them. Hopefully that'll help you in your community as well. And then if you need to see someone like New View, they have been amazing. And if you call them and tell them that you watch the videos, that they can help you find somebody in your area that does something similar, because it's not very well known. And so they're working to get more education out there about the type of vision therapy that they do. My son has ATS, and that's how we found it. His corneas were degenerating, so he had to have a clinical trial corneal cross-linking back before it was FDA approved. And so even as thin as his corneas were, it had to be done off-label. So very, very extensive. It's very rare for them to have it twice, and Aiden needed to have it twice in order to stabilize his corneas. And so he also does Braille. So that's, I guess, an assistive technology that he is learning. Not everybody with ATS needs to, but because we know that the cornea is affected in everyone with ATS, that's one reason why we did the videos with New View, is just to help the population know that there's supports like that out there. Armel, I'm going to send it back to you.
Okay, so I have two things now. I would like to address any issues with anesthesia. I think it was in the chat that was on one of the questions. So if some of you had a different experience with anesthesia due to their connective tissue disorder, would you like to share it?
I can share. I've had multiple surgeries with anesthesia, and the first thing that they noticed was that they had to use a little more anesthesia for me. The second thing is that I'm a little bit more difficult to wake up afterwards. And then the big thing with Myri with anesthesia is the when they intubate, um, if they scar the trachea at all, that that has scarred shut in people. The last surgery that I had, which was a hysterectomy, they did end up scarring my trachea, and so I do have a scar there that they're monitoring right now. There's not much they can do. They can open it, but it comes right back. And my understanding is that a tracheostomy actually scars as well. And so I have opted in my living, sorry, I have a little bit of cold. I have opted in my living will not to do a tracheostomy at this point in time.
Sky, did you wanted to share something?
Sure. My name is Sky, and I am the parent of a daughter with Milan syndrome. She's 10. And I'm seeing a lot of overlap when we talk about medications. She also takes migraine medication. She takes cyproheptadine for migraine. She uses assistive technology a lot in the same way I was telling Maya, a lot in the same way that Maya does. And she has AFOs that are hinged as well because of ankle issues and muscle issues. So it's a lot of an overlap. For anesthesia, she had 5 procedures with anesthesia this year. She typically does not have any issues other than she suffers from severe post-operative nausea. So that is a challenge because like Patty, she metabolizes very fast. Milan syndrome is an all systems disorder, and it's an overgrowth disorder. So so while she metabolizes, they cannot give her more anesthesia because of her severe nausea and sickness afterwards. So it's a real balance finding the right, anesthesiologist who really knows that well. So we always request someone. But I do see a lot of overlap on connective tissue issues with the other groups and other patients.
Thank you. Thank you for sharing. Is there anyone who had a bad experience with anesthesia due to connective tissue disorder?
Morphine doesn't cause. Oh, go ahead, Kevin.
Twilight sedation and Versed does not work on me. I fight Twilight sedation.
Oh.
Yeah.
I also do not handle twilight sedation, although I don't think that has anything to do with Marfan. Like in general, we don't have anesthesia specific issues. I have, I get treated with Zofran through the IV before they wake me up because I can't throw up from some of the surgeries that I've had. Like I physically am not able to. So they try to treat the nausea before it can happen with anesthesia. I know with Loeys Dietz, one of the related conditions that they have airway issues. And so intubating them for anesthesia can be difficult, particularly for type 1. And so they have to come up with an anesthesia plan prior to surgery for those patients.
The same for ATS. Aiden has issues with anesthesia, and it's not necessarily as much as the anesthesia itself. It's waking up and the way that, well, it kind of causes like a pulmonary reperfusion, like the lungs just have a really hard time refusing the oxygen and getting awake and different things like that. Not to talk about our educational videos again, but we did make a point to make this a concern. And so our cardiac anesthesiologist, Arkansas Children's, has done a video with us, and it talks about the difference sometimes with us having connective tissue disorders, the way that, the tube would need to be inserted or how they need to maneuver things. There's just a lot about anesthesia that with connective tissue disorders, we should be aware of. So I'd like to share that later on with you guys. But Christian, do you feel comfortable talking about your experience with anesthesia, sweetie?
The last time I had anesthesia, they said I didn't do so well with it. They said that I almost came off the operating table. They said they didn't know what was going on. They said that I cannot have any more surgeries due to what happened last time, unless it's a medical emergency. I cannot be put asleep with anesthesia.
Okay. Does anybody else have any issues with anesthesia? Dave, when you had your aorta repaired, did you have any issues waking up, or did they even sometimes they never even mention it, so you don't know if you have issues?
Yeah, I think I was going to make a comment that I don't think I did, but the problem that I had is that because of the arrhythmia caused by the surgery, however that all happens, they had to they were running in and out all the time, giving me some sort of injection to stop the arrhythmia, and I was allergic to it. So I would go into nausea immediately, which, after you've just had your chest put back together, coughing is not high on your list of things to do, and retching is certainly not on the list. That went on for 3 days. And then it finally, they changed the medication, the dosage, and we finally got it under control. But that was kind of a scary thing. I'm not sure it's anesthesia at all related. As far as I know, I didn't. The only thing I remember about the anesthesia is that before the surgery, they shave your chest, do the basic things, which for me is easy because one of my conditions I have is I don't have any hair except all over my head. So they didn't have anything to do. But I don't remember anything from the time I went there until I recovered from surgery. So whatever they gave me as far as anesthesia wiped out my memory from the time I went into the room until I woke up. And I don't know how they go backwards, but it was kind of a scary thing to say. I had no remembrance of anything that happened during that time. So I guess that's anesthesia related in some way. But no, I don't have any reaction to actually having the anesthesia.
Fantastic. It's definitely an area of interest for us with ATS. And so, like we had mentioned before, this is all about to learn about our similar conditions and where we can work together to create new research on the back end. So I definitely will work with the patient group leaders, but if you know of somebody else in your community that has those issues, make sure you reach out to your leaders so that we can work on a game plan on how to help educate providers as well. Armel, are you ready for the next question?
I just want to ask one more question about to Kate. So do you have a different experience with medication because your son is really young? So how's your experience is different from adults?
Sure. Yes. At the moment, he is only on levothyroxine for his thyroid. Thyroid isn't officially, hypothyroidism isn't officially declared as a MyRe symptom, but as we are seeing in the community chat and where a lot of these chats happen, you can find out a lot from that. And there's a good number of families who have hypothyroidism as well. So again, it's something that I think is connected, but it hasn't officially come together yet on that. I'll throw this to Don as well, because Don is our vice president and Don has a daughter with MyRe as well. So Don, do you want to talk about your daughter's medication? Oh, Don, we can't hear you.
You might be on mute.
Is this any better?
Yes.
Yeah, we can hear you now.
Yeah, really short answer. She's not on any medication. She does have a lot of constipation issues, which I've seen there's some overlap there with some of the other syndromes. So we dose her with Miralax pretty regularly. But yeah, no medications right now. But while I have the floor, I will say related to the devices, she does have some relatively minor hearing loss. So she wears hearing aids for that. She sleeps with a CPAP as often as we can get her to. It's just a nasal CPAP. I know there people are talking about fit for the face. We haven't tried a full face one because she's so young and she has some history of throwing up in her sleep. And so we didn't want to block her mouth. And so she wears just a nasal CPAP, and which is effective unless she has a cold. When in the winter, there's a lot of colds, and so she wears that. And I think she's more energized when she wears it. She has a severe speech delay, so she doesn't talk. So it's hard to figure out the impact there. And I thought there was one other device related thing, but it'll come to me. Anyway, we try to get her to use assistive technology to help her communicate. But she doesn't need any devices yet to help with motion. She's been in physical therapy for just as a kind of a preventive means for several years now. So she's pretty mobile and active, and so we're just trying to stay ahead of all the things that may be coming her way. But yeah, hearing aids and CPAP.
What type of assisting communication does she use? Is it cards or?
She has a tablet. It's I think it's Talk to Me or Speak to Me technologies. And it just is one of those where you press an icon and it says a word for you. And to be honest, we haven't gotten past the phase in which she just presses every button on the screen. She does not use it effectively. We're still in the training phase on that one.
How old is she?
She's 4.
Oh, okay. Oh, yeah.
Yep. And she's a bit delayed, so she's more functioning like a 3-year-old, which is fun.
Just to add to that, Josh is at school looking at an assisted aid into exactly the same as Don, because he has speech delay. They want to investigate whether he can communicate, but he has a stutter as well. So they want to give him some aid, which means that if it is needed and he can't get his message across, he has something to help him, because they're concerned that if he was hurt or if he needed something from them, he needs to be able to tell them in other ways than other using his speech. So they are at the school going to start introducing a similar feature with an iPad with words that he can tap in as well, that articulate what he would like to say.
Does he have hearing loss also?
He is fluctuating. So at the moment, we're just about to go back for our next check next month. And if it's still the same, they're going to start introducing the conducting headband as a start, rather than go straight to hearing aid, because it's fluctuating. They don't want to go to a hearing aid where they might get the levels wrong. So they want to see if the headband will work first, but we are just awaiting the next hearing test to define whether that's his next step. But to be fair, with Myri, with everything we know about hearing loss, it's coming. It's fair to say it's coming.
And
so, sorry.
For your son, it's the same. They don't know. They looked at the cochlear nerve, or they don't know where it comes from, or they
yeah, they're saying that it was very unusual. They thought the machine was broken. It's classic. People like Patty's nodding. They were like, "Why is his eardrum not giving me any bounce back whatsoever at all?" And then she went, "I'm going to go and get another machine." Doesn't matter what machine you use, that's the same. So yes, there's still a lot of unknown about what's going on, but as Patty said, it can be a mixture. So he's still at those early stages of identifying exactly what his hearing balance is going to be, but yes, he obviously has very, very, very narrow ear canal and ear tubes as well, which any buildup of wax, I think, interferes also with that. And he has obviously a lot of fluid that is built up as well, which won't help.
I also wanted to say that I was selectively mute from age 2 to age 8, where I didn't speak to anybody but my family. And it wasn't that I wasn't able to communicate. I could talk and say whatever I needed to my family, but I just refused to speak to anybody else. They thought that I didn't know how to read or anything else. And finally, when I was 8, I started talking to teachers. Of course, this was back in the 70s when if you weren't half dead, they didn't investigate anything. So, no one really looked into why I wasn't speaking. But that was the story for me as a child as well.
Andrea, I would add one other thing. I didn't realize, I think I learned something today, and that is before I had all these episodes and got diagnosed, the first time I had pneumonia, my thyroid quit working, and that was before the aneurysm was diagnosed. So I've been on levothyroxine forever, and I never made any association because it was a total different thing, but it sounds like I'm pretty much deciding everything that happens to my body is related some way to cutis laxa. I just don't know how yet.
And that is very possible. And that's something that we should look into more. I think we oftentimes focus as rare conditions on the symptoms that are the most emergent, like cardiac or vascular, or whether it's hearing loss or whatever it is for your particular family. I think we focus more on those things, but it's a great thing that we should look more into, because maybe there is something underlying and we're just not realizing it, because they're still learning about our genes and how the different variants affect, all the cells' metabolism and the way that we process proteins and amino acids and different things like that. So it's definitely very possible that it's affecting many other systems.
Yeah. How many people are on levothyroxine? How many other people have thyroid problems? So it sounded like several. I'm like, wow.
Yeah, it was a little surprising for me too. So, yeah, that's a great thing that we should start looking into. So our next question, Armel, are you ready for number 3?
Yeah. So on another type of questions is more about where you would like the future to go. So which type of symptom you would like to address in priority. And the next question would be, what are you ready to go through to get into a clinical trial for that new research, or even to get a treatment? So I don't know who wants to start with, maybe Gavin, sorry.
I kind of want to go with the headaches. Like I work on more on the headache side of things. Is that really what bothers me the most?
Interesting.
Because it's like a daily occasion.
Gavin, with the research that your mom's doing on FG syndrome right now, are a lot of the other patients having issues with headaches as well?
Yeah.
Migraines are common. Migraines.
Yeah, migraines are common.
Do you have the vision distortion with your migraines, or is it just the pain or nausea?
It's like all like a little of both, not a little of all. I say, like, it depends how bad it is each day.
Well, I can assure you that that is on number 1 on your mom's list when she's having all these meetings with those doctors. I promise.
Yeah.
So if someone would come to you and say, okay, tomorrow you can participate to a clinical trial, do you know what is a clinical trial? So it's the study when we have a potential new drug, we test it first in animals, and then we are going, if it's good and not toxic, not too much toxic, we are going to try them in humans, so in patients. And so we ask patients to take the drug, and we follow them to see if the drug is effective. So that would mean maybe that you have to travel to go to the clinic to try the medication. That's now less and less. In rare disease, we don't know anymore the placebo versus the treatment. So that's not into consideration. We do we compare to the normal evolution of the disease. But would you be ready, for example, to have injection in your muscles, to have so can you describe what you would be ready to do?
I'll be ready to do anything, honestly. Yeah, just to get rid of the headaches.
Okay, that's a good indication.
I would like to see a study, and it goes back even further. So I spend a lot of time in genetics now too with my companies, but people that start with congenital heart problems at birth, whether they're repaired by surgery or whatever, seems like that is the organ that tends to have the first indication of something's going on, and then it's never followed. It's not something you would ever do in prenatal screening, or there's no way to tell if there's a genetic component to it. And I'm saying, well, we ought to be better at evaluating those kind of people sooner for genome sequencing, something to take a look to see if there's a genetic component, because I suspect in a lot of cases there is. And it may not just be heart, it could be other problems that people have. That happens to be the one that I'm the most familiar with. And it would, in my case, would have shown up immediately, right? If they'd have done the test, they would have known. And it would change a lot of things. And I know that, like my daughter at Emory, they work on adding things to the prenatal panel all the time. They're always trying to get, she's a specialist in lysosomal storage diseases like Fabry and Gaucher and Pompe and some of those. But it's a real hard thing to get people to add, politicians especially, to add to those panels, to say there are a lot more things we could find a lot sooner if we would spend the time. I don't know how to do that. And as far as clinical tests, I'm in a couple of trials now, and do anything you want to do it. Let's go. And it's not going to make a difference in my case, but it could sure help. My kids down the road, my kids they're all carriers, but don't seem to have the condition. And my grandkids, I have 5 grandsons, don't seem to have it either, but it's going to be back. I mean, it's just a matter of time. So I would like to head that off.
I'm sorry, Dave, I did not mean to interrupt you, I promise. Yep. I would like to work with you on that, because I do work in the genetic testing industry. I know ways around that we can get your companies involved in some research, and I'd like to talk to you about that.
Okay.
We got a lot of things to talk about. We just need to set up some time together.
Well, I think having these diseases and having the longevity to do something about it and make a difference. So, that's kind of been where I've been the last 15 years. It's like, well, why am I going through? Surely we can help other people. There's no reason why everybody has to go through what I went through and make your own genetic counselor to get diagnosed. That takes too long.
Yeah. I love the way you think. We've got a lot of work to do. So anybody else, like, what would you be willing to do for a treatment, and what symptom are you having that you would like the treatment for the most?
Sorry. Go ahead.
So I would like to talk about something different. I don't know how the rest of you feel, but as an adult with a genetic condition, I feel like I am running around to all of these different doctors, and none of them are communicating with each other. And so what I would like to have happen for a research study is what happens if we have collaborative care. Does patient outcomes improve because the doctors are communicating with each other? I can't even get pictures of the last surgery to my geneticist because they won't release them because she's not on the need to know list. And it's so frustrating to me that so many things are going on and no one will communicate with each other. So that's kind of one of the things that I would focus on.
Yeah, so that's mainly, usually it's the patient organization that take care of that and organize expert centers, so clinical centers just for your disease, where all the different specialists will be communicating together and even organize when you go for a visit. You don't have to go at different days. The same day you go, you will see all the different specialists and they will have a meeting later. So that's, unfortunately, there is nothing organized generally by the clinics. It's more an initiative from the patient advocacy groups that create these kind of clinic centers.
I would disagree, Armel. I mean, the Marfan Foundation has a directory of clinics, but they're created by the local hospital systems. The foundation has got, yeah, the foundation will say, okay, to be on our directory, for us to advertise for you, you have to have a cardiologist, an ophthalmologist, and a geneticist.
Yeah, so the patient organization is at the origin of that.
No, we just, the hospitals create them and they just come to us for marketing purposes, but they all have their own policies. At least half, if not more, do not have clinic on the same day. So like when I travel to Hopkins, I have to stay there for multiple days for us to see all the specialists. And they only communicate amongst the specialists that are involved in the clinic. And even then the communication differs depending on the hospital system. So it's like, they'll send letters to my GP, but I'm still having to discuss like my allergic reaction with my allergist to the medication that my neurologist prescribes. I mean, those don't have anything to do with the Marfan clinic, but I'm having to navigate all of that. And then the neurologist wants to prescribe a medication. I need to call the cardiologist and get that approved through them because they're in different hospital systems. The only thing the foundation provides is a listing of these self-reported clinics, but they can't go in and change hospital policy or hire specialists. And there's still a lot of patients whose needs are not met by these because they don't have access. I think we have like 35 across the country, but like 6 are in California.
So there are some organizations where Marfan maybe can contact and take advantage of and share. The organization can share their experience, like the Children's Tumor Foundation. And they have those clinics where you go and everything is taken care of and you don't need to go through different days, and you really have everything centralized. So
we do have that.
Yeah,
we have a clinic in Boston that offers that. And right now, Mayo is in the process of setting that up. And it's my geneticist that's organizing it. And I'm helping her by telling her, yes, this doctor works well, or no, this doctor doesn't work well. So we're kind of a collaborative effort together. But just getting them to communicate together so that when I go in, I don't have to tell my entire story all over again. And also, adults don't have clinical coordinators. They don't have care coordinators. They don't have, caseworkers. They don't have any of that stuff. So I have to manage everything.
Yeah.
And that gets to be a lot. But if I had to focus on a symptom, it would be the joint stuff. I feel like if you don't get the cardiac stuff, the severe cardiac stuff when you're young with Myhre syndrome, that the thing that is going to affect you the most is the joint issues as you get older. And that is the least studied. They don't really understand exactly what's going on with our joints. And I am willing to do anything. I've flown out to NIH to give skin samples and gave 35 vials of blood. I'm willing to do anything that I can to help in any way that I can.
I think the thought on the multidisciplinary clinic or approach, it has multiple facets to it, because I agree with what both Armel and Maya are saying. A twist of fate, we have started 4 multidisciplinary type clinics or avenues for patients. But when and that's great. And we need to be working on doing those things. And like the Marfan Foundation having the list of clinics that, and Marfan is a little bit more well known than ATS or Lois Dietz or maybe Cutis Laxo or some of the others. And so I think physicians are like, okay, well, I can treat that because I see it more, and maybe they're more inclined to start those initiatives with their own facilities. But I also see the other issue is we need to be working as patient groups. And I'm not saying that we're not doing this already, because I feel like we are, but I think we need to have more patient education to teach each patient how to advocate for themselves better. Because Patty, you've had to learn from the School of Hard Knocks, and so did I. When I email one of Aiden's doctors, I know that I'm going to get a response right away. I don't abuse having the information or the power that I have. And I always work with them to help other patients and things like that. But I think it's a multifaceted issue that we have to work on. And unfortunately, it's such a huge bite to take. Maybe that's where the patient groups can come together and try to, to create better education for our patients. The thing that scares me the most is I feel like everybody on this call is a great advocate for themselves or their family member that have these conditions, but what really scares me the most is the patients that don't know how to advocate and be able to connect like Maya does with her allergy medication and her cardiologist and those things like that. I mean, that's the scary part, and that's where we're missing out helping these other patients, I think. Sorry, that was my little 2 cents on that, but I do feel like it's a big problem that we need to address.
Yeah,
I
I
also
think
think
one of the other problems is the transition between the pediatrician to the adults.
Absolutely.
And creating adult clinic center is extremely expensive, but there is the necessity to do it. That's also something that's important to work on, I think.
Yeah, I was going to say that the year before my surgery, my doctor that my cardiologist that I've been seeing for 10 years, the head of cardiology at Mass General, was familiar that I had a genetic condition, but that wasn't his specialty, and he didn't know anything about it. But the year before my surgery, I flew my daughter up, the genetic counselor, and said, let's go talk to the doctor because I know I'm going to have this surgery probably next year. And she explained what was going on, and she said what he heard was it's a plumbing problem. And she's saying he's got a connective tissue, he has soft tissue, he's going to be different. When you get in there, you're going to see things you weren't expecting to see. And so anyway, the result of that conversation, I didn't feel like it went very well. But when I got the next year to have the surgery, when I met my actual surgeon for the surgery, it turns out he did hear us. And the surgeon had come from Johns Hopkins and had worked for Dr. Dietz in connective tissue disorders. So he was very familiar with my condition. And just the comfort level of knowing that getting ready to go into this major surgery made a huge difference. And I felt like, oh, it works, but that's not the way it should work, right? It shouldn't be that we have to do all the work to get there, but at least we got there. And how did it affect it? I don't know, but it worked. So I guess that's a good thing. There also now are data aggregators. And in fact, the Epic and Cerner, the big hospital systems in the country, Epic being the largest, are starting to share information through opt-in capabilities. So for instance, my records between Mass General and Atrius, which is my primary care physician, are shared. So they see everything back and forth, which is a huge thing because my primary care physician doesn't know anything about genetics or heart surgery, but now he can see my whole picture. Before that was all isolated. He knew nothing about what was going on with my echocardiograms or anything else, unless I brought him and gave him a CD and said, add this to my record. It was on me to make that happen. And now they can share. But I'm saying the industry is moving more toward, you'll hear this a lot, opt-in databases where you can consolidate your hospital records, which is the first step on somebody being able to look at your whole condition. And for all of us, we've seen so many, I don't know, I've been 5 or 6 different hospitals and all these records. Trying to get all of that together is really a hard problem. But this is a step in that direction. I don't know how long it's going to take, and it's certainly not an easy problem, but there are people starting to think about it. And I think it's on us to push it, to make it happen, that our record gets to the right people with all the information.
I used to be a medical coder and did release of information, and it's called Care Everywhere. And so, but the problem is they can see everything but images. So they can't see like the actual CT scan or the actual MRI yet. They're working on it, but they don't have that ability, but they can see everything else. And that's been very helpful. But the problem is educating the doctors that they need to look at that, because I don't know how many doctors have come in and been like, just completely uneducated and not looked at anything, and then I have to advocate for myself and say, have you looked at anything? Have you, do you understand what my condition is, and blah blah blah. And it gets frustrating after a while. It's difficult, it's draining.
There is the two initiatives, the Citizens and the All Stripes, where you can upload all your data and then it's accessible. They were functioning through financing with the pharmaceutical industry, but seems that at the end, after maybe 4 years, they are not really getting anywhere, and it's very difficult to get the for the organization or researcher to get the information back. So that's something people are working on for a few years now, and I think the Epic system that can, if it could be really shared between all the hospitals, would be an answer, because the Citizens and All Stripes, I have a bad experience with that. I don't know if other organizations have good experience with those. So I would like to maybe wrap up, not to go too far outside of our time schedule. If we can do a quick roundtable. Kate, what would be your preferred or prioritized treatment area, and what would be your approach to clinical trial?
I guess currently Josh doesn't have a huge amount of the symptoms, but doesn't mean they're not going to come. So I would look and echo what Patty said about the connective tissue and what is going on to cause the multi-system. So of course, cardiac would be something that we would focus on in terms of that's what might cause premature fatality. But actually the bigger picture of what it's doing to all the systems and why the tissue is behaving in this way would be something that I would really like to be looked into, because I think it then has that holistic approach back to it. Clinical trial wise, yes, it's something a parent has to think about. You're putting your child in that situation, but again, if it's rigorous and it's proven and it's based on good science and I feel satisfied, then of course, yeah. And Josh already is contributing with samples and is involved in NIH discussions and all that kind of thing. So he's giving data and he's giving blood. We haven't done any tissue samples yet, but yes, we're very much open to the collaboration. It's a difficult one depending on the exact clinical trial. I think I would have to see what you're proposing, just because it's not me, right? I'm making a decision on his behalf. So it's always something in my mind as a parent.
Thank you. Sky?
I mean, I think I want to echo, what Kate is saying. I think what kind of everyone is saying about learning more about the connective tissue, or the part that, and getting some research done on that area.
And in terms of treatment, what symptom would you like to prioritize?
I'm not sure. I'm gonna need to. I'm gonna have to get back to you on that one, Armel.
Okay.
About
that. Don, do you have an area where you would jump immediately for a treatment?
Yeah, in terms of just impacts to the Myhre syndrome community more broadly. I mean, it's pretty established that cardiac related issues, aortic stenosis, pericardiomyopathy, anything that's restricting the heart and the from expanding and contracting appropriately, and the arteries, they tend to shrink prematurely. So it's, I think, first on top of everybody's mind in our community. Pulmonary fibrosis, also a concern. As Patty was mentioning, with her oxygen levels at night, it's progressive and well established in our community. And like Patty said, the joints, the musculoskeletal system, I can see all of these things, just maybe the shadows of them, the first bare indications of them in my child, but like I said, she's only 4. In addition to that, I don't know if it's treatment in the pharmacy sense, but the neurologic impacts, the development, I'd like to see some more studies there in terms of how it affects not just speech, as I mentioned earlier, but behavior in general. I feel like there's just a lot of unknowns in that field. I don't think a lot of questions are being asked in that area, or at least being studied. So be really interested to learn more about that. Those are my top 4.
Mel, I'll jump back in and just say it was just hard for me to prioritize a single thing, because when we think about our daughter's symptoms and all of the systems being affected, but I know something that we have been talking about is more research being done on in the reproductive realm and hormonal, those kind of things, for our community and for our daughter. This is something that is on our minds right now. She's almost 11 years old, so that's kind of the realm in which we're having a lot of conversations right now.
Okay, thank you.
I'll add to that. I know I didn't make it into my top 4 list, but in our community, precocious puberty is something that it's at least a significant portion of the population is affected by. I think it's less than 50%, but still, it's not a trivial number. And so, endocrinology and those related issues are certainly impactful.
Wants to go. So we have Gavin. Does someone want to?
I can. For Marfan syndrome, when we've asked the community this, the overwhelming response is research into pain management, especially with dural ectasia, because there are so many issues that are caused by that. It's essentially an aneurysm of the dura sac, and most people have cysts that go along with it. So, like anecdotally, some people get help short-term with steroids, which you obviously can't be on the steroids for a long time without significant risks, or narcotics. Those have their own side effects. And so there's just not really good answers for managing that. And within the neonatal Marfan syndrome community, those are kids who are born much more severely affected, and it can be more of a life-limiting diagnosis than classic Marfan. They get emphysema, or can get emphysema from a very young age. And we don't have anything to treat emphysema. There's no cure. There's nothing other than using inhalers. And so we would really like to put money into lung research, because, with the aorta and with the heart, even if they're having issues, at birth, we can do open heart surgery on a baby, and we can do open heart surgery on a toddler. But if they have emphysema at a year old, there's really nothing that we can do.
I have to piggyback on what Maya said. For ATS, I am willing to do just about anything that needs to happen for any sort of therapy that comes out for ATS. Right now, we're looking at a new animal model that has a lot of promise, and we're looking at different chemical compounds. So that is something that's for the vascular system. So that's something that would be a high priority. And then the other thing is, we feel like it's kind of an easy target for ATS is having some sort of approved therapy for the corneal degeneration within the next couple of years. And then after that, I think mental health is a very important part of it, because I think we all deal with it because we're dealing with so much pain and so much uncertainty, and it's very scary. And so, PTSD is a real thing for those with any kind of condition. But I think for rare connective tissue disorders, that's a big thing. And another thing that I'm gathering from this is that there's not enough understanding about the mechanisms behind what creates our condition. There's lots of different variants that can cause a very wide range of symptoms. So someone with ATS might have a lot of tortuosity, and then someone else, depending on the variants they have, they could have more hernias and hypermobility and different issues there. So I think though for ATS, those are the areas that I would like to heavily see research and clinical trials on.
Thank you. Well, I think we had everybody. Christian, we didn't hear from you. Also ATS patients. Do you want to add something, Christian, or is it you agree with what was said by Andrea, who is also in ATS? We lost him, I think. So I want to.
I'm here.
Oh, here is he. Yeah, here.
Yeah, I agree with what was said.
If you personally had one thing, Christian, would it be your eyes? Would it be the anesthesia issues, the heart? What would be the number one thing that you would want us to focus on?
My eyes.
Okay.
Okay, thank you. Well, we are just on time. I would like to thank all of you. Just to remind you, maybe I can share my screen again. Remind you that there is the survey is still ongoing. You have here the QR code, and I think you have the address, the web address of the survey. And in 2 weeks there will be the third panel that will be more about knowledge gap and communication with the different clinicians. I will have the survey open until end of March, and then we will be able to do statistical analysis and mix that with the analysis of the panel discussions, and that will be presented in the first webinar for patients that will take place in April, I think. With all the analysis and the conclusion we have from there. I don't know if any one of you have any remarks to say or something else to add before we split to our weekends.
Mm-hmm. Just want to say thank you. I think this is much needed. I think we've been talking about this at our foundation for a number of years, the collaboration. I think there are so many things we're sharing today where there's nodding of head, and I'm really excited about partnerships like this and for bringing our community into all these discussions. I would say with Myhre syndrome, and this might be with all your other syndromes as well, we have many different symptoms, and I think it's really important we represent as much of the community as we can, because as we alluded to, some people might have very strong behavioral problems, whereas some people might be born with congenital heart defects, but we're all within the same syndrome. So I think it's really important to make sure as many of our community members participate so that we can get the full picture, because as we're seeing, if you pick certain pockets, we might be coming up with things like hypothyroidism. If you pick other pockets, we might be discovering now a diabetes resistance. So if we can encourage as many people in our community to get involved, it means we're really getting the entire picture. But thank you very much for inviting us to this, and thank you very much for bringing us all together and more of this.
We are very grateful that you guys are participating with us, and to the other groups. I just see a very bright future, and the webinars are just a really small part of this project. So if you can encourage your patients to fill out the survey, I know that we're going to have more discussions on that on the side, but I really feel that the more participation that we have, the better view on the back end that we can get to know what we need to do. So I'm very grateful for everybody. This was a dream of Armel and I's, and we sucked Jade and Sky into this along the way. At the very beginning, it was difficult to come up with the project, but just because there's so many facets to it, like we could make this as large or as small as we wanted to, and I still don't think that we would cover all of the needs of our community. So I'm just very, very grateful. Everyone, if you have another patient within your community that you would like to be on the next webinar, it'll be that discussion will be like more about how the physician patient relationship is, and if it's the same patients that you'd like to have participate in the next webinar, that's fine as well. But I'm very grateful for everybody that's participated today and last week. I can't wait to go back and watch the recordings and get those out to you guys so that we can start making plans for new collaborations.
Okay, hope to see you soon.
Thank you.
Thank you. Thank you, Armel. Thanks, everybody.